It is Dr. Stuppy. Today is December 11th, and we just continue in this weekly saga of Facebook Live posts. Each week, each of the physicians says, next time, I am not going to talk about COVID. We're going to talk about something new, something exciting about pediatrics. Um, every week, it seems there's something so important to talk about. And of course, this past week, we've had changes in the guidelines for the quarantine. We've had vaccine talks coming up with hopeful authorizations, and people are scared about the vaccines. And then we've got the Christmas looming, Thanksgiving, all of the recent travel with that, with numbers increasing. So much to talk about. So even though I was planning on talking about something else, we're going to tackle all of this stuff. Um, and I do want to say that a lot of this is going to be coming from the heart. I have a family just like all of you. My family, I do feel like, is high risk. My husband and I have both worked outside the home this whole time. I have two college age kids who have gone to two different campuses. Um, and that was fine. They left. I didn't have to worry about them bringing stuff into my home. But now they are back. Each of them finished with being on campus before Thanksgiving, came home, and is home until end of January, beginning of February. Um, but that increased risk. And I am going to apologize. I feel like I have a bloody nose coming. No, nothing there. I don't know why. Sorry. Hand sanitizer time. Um, so, anyway, what my family has done this whole time is basically just hang out with each other. We have not eaten in restaurants since last March. We have not done our usual, like, hang out with grandparents. My husband's parents live locally. My parents live in the St. Louis area. We haven't been able to see them like we typically do. We have done more Zoom. We used to just do weekly phone calls when we didn't see grandparents, and we have done more Zoom, which actually can be kind of fun. Um, I've got to see even some of my nieces and nephews that I wouldn't typically get to see. So some of that is good. But it's hard. And I know it's hard. And I know I'm breaking my mother's heart every time I tell her, no, we're not going to do Thanksgiving. No, we're not going to do Christmas. But she understands. And it's because I love my parents that I'm not going to see my parents. It's just at this time of year, we can't even plan on doing something outside on the porch or on the deck. It's too cold. So we will do another Zoom Thanksgiving. Both my kids came home from two different college campuses. So then we're dealing with my husband and I, who've been in Overland Park, my kids who have been in two different cities, and all of the college COVID risks, because we know that that age group has so many. Um, I wanted everyone to wear a mask, at least at the beginning when they were here. So we did. We wore masks in our own home unless we were sleeping or eating. We all have our own bedrooms to sleep in, except for those of us who are married in the home. Um, and then eating, we talked about eating separately, but our risks were low enough. We hadn't had any exposures. And both my kids got tested before they came to um, back home. So we did eat at the same table, without our masks, obviously. But then we put our mask back on while we were finishing the conversation right after we finished eating. So we have all been masked pretty much in the house, which was fortunate because one of my family members through work was exposed, um, and has since tested negative. But we were all happy because even within our own home, we didn't really worry as much because we didn't have that 15 minutes of unmasked exposure. All of our contacts had been masked. So um, you have to know the risks of your family. If you guys are working from home and your kids are staying home doing online learning and you really have very minimal risks, finding another family, like we've talked about this whole bubble thing, that is very similar risk and you're willing to accept that risk, you can do that. Any family who has been very well quarantined and staying home most of this time does not want to interact with my family because we have not been doing that very well. We do work outside the house. We do wear our masks. We are very good. Thankfully, my two young adult children are also very good because that age group in general is not very good about wearing masks. And I'm very fortunate that my kids, and it sounds like all of their friends that they did hang out with, they limited that number and their friends wore masks pretty well too. So hopefully, my family can make it through. We are so close to the light at the end of the tunnel right now, guys. The vaccine is available, hopefully, very soon. I just heard today when I was doing hospital rounds at one of the local hospitals that the nurse had just gotten an email and she got her date that she's going to start getting vaccinated. So it's getting real, guys. We are so close to the end of the tunnel here. If we can wait until people get vaccinated and hopefully people will accept the vaccine, I do think that there's a lot of fear because it's a new vaccine and it went through things really fast and everyone's worried that it wasn't tested properly. We have to trust the scientists here. I am not a research scientist on vaccines. I know that I don't know enough to look at the data and be particular about whether or not it's appropriate. But I do know the right people to look at and trust. And I trust that the authorities, the people who have been doing this research, who know what they're doing and what they're talking about, I trust that they did it right. And we all saw that when these vaccine trials were halted because there was a concern, they went through the data, they went through everything, and they made sure it was okay before they proceeded again. That's how science works. Um, the reasons they were able to get it done in such a short period of time include things like they didn't have to wait for funding. You know, a lot of research has to wait until they can get approved for funding. They have to wait until it's approved through their ethics committees and everything else. All of that was fast tracked. All of that was rushed. Money was thrown at them worldwide. Different governments all wanted this research done. So worldwide, this was priority. And so that was gave them the ability to do things on a faster scale. They still had to recruit the people, but so many people wanted to be vaccinated. So it wasn't as hard to recruit. I know sometimes our office has participated in trials, and it's hard to get people to say, okay, I'll let my kid be part of this trial because it's new and different, and people are afraid to do stuff like that. But with this, people were afraid of the COVID virus itself. They were afraid of the disease. There were lots of people willing to um, do the trials. I know I tried to sign up at one point at the beginning and couldn't get in because it was already full. So that's good news, right? We had lots of people who were willing to do the trials, and the trials seem to be very effective. I mean, some of these companies, over 90% effectiveness of this vaccine. So that's fantastic. Some of the vaccines aren't quite as good, apparently, but we're going to learn more about this the more people that are vaccinated. So hopefully soon people will start to get vaccinated. And actually, it sounds like even next week people are going to be vaccinated. And first, it will be the high risk people, the people who are in healthcare, first responders, people living in nursing homes, older people. I'm not exactly sure all of that. I haven't had a chance to look. I know that the talks just started yesterday and they authorized the approval, but all of that has to be set still. And I haven't had a chance yet today to look into that. Um, but I'm super excited. And will I get the vaccine? Yes, you betcha. As soon as it's offered to me, I'm going to get it. We are on staff at several different hospitals because we do hospital rounds at different nurseries, and we are part of the Children's Mercy Health Network. So all of these hospitals that I'm associated with have emailed and asked if I'd be willing to get the vaccine, and I've said yes to all of them. And I don't know which one I'll be offered first, but I will be getting it as soon as I can. Um, I do encourage everyone to learn as much as they can and make a choice for their family. I do not think anybody is going to be forced to do this. It's possible. I mean, things change. And the more safety data they get, I think the more people will be comfortable with giving it. But looking at your risk, if you are high risk, if you're working outside the home, especially with lots of people in retail or meat packer plants or any kind of food service industry, healthcare industry, first responders, police officers, all of those people who deal with lots of people, I certainly hope that they'll be able to get the vaccine soon. I also think college age kids, and not just that college kids, but college age in general, because we know that people in their 20s and 30s tend to be the ones who are least likely to know they're even infected because they have such mild um, problem. They feel like their runny nose is just from allergies, or they don't realize they're sick, and so they continue to go on with their life. They are least likely to wear masks, or less likely to wear masks, and so they spread. Unfortunately, they can spread to people who are higher risk. And so I actually think it would be a very valid point to vaccinate those people so that they don't spread it. But I don't get to make the rules. We'll see how it comes up. I just hope that when your number gets called, you feel confident that the vaccine is safe and effective. so we can get people vaccinated and we can start actually getting back to normal life. We will still have to wear masks for quite a while because until enough people get vaccinated, it's still going to be out there. And one of the concerns with the vaccine that is valid is maybe I'm vaccinated and so I get a very, very mild case and then I don't recognize it. So then I can spread to someone else. So I still will be wearing a mask once I'm vaccinated. So don't see me with a mask and I'm thinking, oh, well, you didn't get your vaccine because you're still masked. No, we are supposed to still wear masks because we could still potentially spread. And it also helps the community just accept masks because we're going to need to do this for a while. Um, Another thing I wanted to kind of touch base with was the whole quarantine guidelines that um, were approved by the CDC, and they left it up to local people um, to or local governments to decide if their counties would follow the new guidelines. Locally in our area, I think all counties, I know Johnson County, where I am, has approved the new quarantine guidelines. Um, there are pros and cons to this. And basically, the CDC weighed all of the risks and the benefits of having a 2 week quarantine versus a shortened quarantine. And a lot of people are confused about this. It is not a free for all that on day 7, if your test was negative on day 5, that you can leave the house again on day 8 and do whatever you want. This is not an okay to go do celebrations with your family. It's not an okay to let your kids go to sleepovers or to play in their tournament. Those kinds of things still are, within that risk benefit balance. To me, it's still too risky. The reason the CDC made this recommendation to shorten the quarantine is to help people get back to work and school, to help people get to those essential things that we need. The risks go down over time. And I, right before I started this, put a little link to a Facebook page that I absolutely love. Um, the pediatrician mom, I think is the name, and I am sorry if I just messed that up. I did put the tag in there properly, um, but I can just think of her actual name. But the link to it will be in the discussion for this, and I'll put it again in there. She has fantastic posts all the time on Instagram, Facebook about all kinds of pediatric topics. But she posted about the whole quarantine change and the different levels of risk. If you wait the full 14 days in quarantine, there's still a potential. We have found that some people, even up to 21 days after exposure without symptoms, develop symptoms and seem to still spread. But the risks go down significantly after 14 days. Looking at if you have a negative test after day 5, it can't be right after exposure because we know that you haven't had enough time to build that enough viral load in your nose yet to be able to test. Um, but if after day 5 you have no symptoms and a negative test, then they're saying after 7 days of quarantine, so on day 8, you can leave early. And this can be helpful for families to go to work, go to school. I highly encourage wearing a mask and distancing as much as physically possible wherever you're going with that, and to limit it to things that are important, things that help your family thrive. Um, the risk is still there. I think there's, after that 7th day, um, significant risk if you develop symptoms at all. And so we don't want to downplay, oh, that runny nose is just my typical runny nose, or I have a headache and I'm tired. But yeah, because that still could be those symptoms of COVID. And we know that 2 days before symptoms start and up to 5 days after they start is your peak of contagiousness. So you're still in that risk of being able to spread, and you might not know it yet until later. So be cautious, and this is not the time to leave quarantine early to go hang out with grandma because grandma's higher risk being older, and it's not the time to go hang out with your friends playing video games in their basement without your mask. This is a time that essential things can be done. Again, weighing those risks and benefits. Um, And I just very much encourage that people do not mistake this as after 7 days you're clear and free to go do everything, because that's not the message that the CDC wanted to send, and it's not the message that I want our patients to hear. I want our patients to know that 14 days is still ideal. And for things that are not essential, stay on those 14 days, because we would all feel awful if we found out that we were sick and we spread it to a loved one. This holiday season is an especially scary time for me to have that new recommendation come out. I understand why they did it and I support why they did it, but I do think that there's a lot of room to misinterpret it. And after Thanksgiving, our numbers are going up. We are kind of numb to it now. We're seeing as many people die every day now that died during 9/11 or some wars. And we felt really sad at the beginning when a couple people were dying from this. And now we're seeing thousands of people die every day, and we're just kind of numb to it. And that is super sad to me. I want us to do what we can, do our part, wear our masks, stay home when we can. I mean, I still go to work because I have to. I go to the grocery store because I feed my family. Um, but I don't go clothes shopping. I don't go get my hair cut. I don't go hang out with friends. I really try to limit that because I don't want to spread this to other people. We are so very close to having the vaccine available to the public. We are so very close to seeing the light at the end of the tunnel. I know we're all tired of it. I'm human too. I'm tired of it. But we need to be vigilant these last few months and stay indoors when we can. Um, Wear our masks and be smart about it. Um, we can do this. We just have to band together and make smart choices for us and our families. Um, I do not see any comments, um, but I don't know that I would on here. I think last time I did this, I missed out on comments. So if there are comments that I did not cover during this, I will answer them on the comment box. But thank you for listening. And I'm sorry if I'm giving you the answers that you don't want to hear, because none of us really want to hear that. I'm telling you to stay home. Don't go celebrate Hanukkah, Christmas, Kwanzaa, New Year's, any of those things with friends and family outside your living space. Celebrate with your family, come up with new and fun things to do. Um, just like on Halloween, we have new and different ways to do things. We can come up with those for Christmas. And I didn't really talk about that, but you can walk with your kids around the neighborhood at night and look for different aspects of decorations. Come up with a scavenger hunt list, and a house that's all blue lights, a house that has 3 blow-ups in the front yard, a house that has sparkling, twinkling things. Whatever you can do, come up with things that can make it fun and unique for your kids. There are lots of drive-through things. I know that they've gotten backed up and people have to wait a long time in the car, but come up with things in the car to do. Think of puzzles and games that you can do in your basement or your living room. Have a movie marathon and watch some Christmas movies. Um, Zoom, Skype, do whatever with extended family, and it's fun. My sister-in-law actually came up with a Kahoot game that was all like family history kind of questions, like when grandparents met or married, when different kids did different things, what dance one of the little cousins likes best. She came up with just fun Kahoot things. Kahoot's free. I think it's just Kahoot.com. If you search Kahoot, if you've never done it, if you have elementary school aged kids, middle school or high school aged kids, probably even, they will have Kahooted. So you can ask them about it. It's easy to set up some simple games, and then you can screen share, and everyone just hops on their phone to do things, answer the questions, and it's just fun family competition, kind of like playing a game in the living room, only you're doing it online across the miles with your friends and family. So we can make new things, make this work, make it fun. We don't have to give up on everything, but we just have a few more months to do this, and I really, really hope that people can um, figure out ways to enjoy without too much interaction with everyone else. So sorry about my rant, and I hope I ended that on a fairly happy note. And I am encouraged about this vaccine coming out, and I'm very hopeful that we can get this ended within the next 6 months, maybe. We'll see. So take care. I'll look at comments after. Thanks. Bye, guys.